Good morning, class. Today we're going to discuss critical incident analysis, which is an important tool when instructing students. This is especially true for nursing, where critical incident analysis has proven to be very beneficial. But let's first define how critical incident analysis can be applied. According to the American Association of Nurse Anesthetists, a critical incident is a powerful and overwhelming event that lies outside the range of its usual human experience. It has the potential to exhaust an individual's coping mechanisms, resulting in psychological distress and disruption of normal adaptive functioning. Events contributing to critical incident analysis include a breakdown within the health system, like communication, rather than the fault of the individual. This means that as healthcare providers, we are all responsible for the safety of our patients. I see someone has a question. Yes, Miles.
Yes, Mrs. Ross, would you please describe to us how critical incident analysis benefits nursing?
I just love it when students ask questions. Well, Miles, critical incident analysis promotes and improves concept mapping, critical thinking, clinical skill sets, and most importantly, it promotes safety among clinicians. Wow, critical incident analysis sounds very important. Yes, it is, Susie. It can be very important. Wow, are there any examples of critical incident analysis that we can see? Oh, yes, there is, Amanda. We are actually going to watch a case of the ruptured appendix. However, after the clip, you will all be expected to define critical incident analysis and state the benefits of applying critical incident analysis to nursing. Now, let us all focus our attention here. My stomach is hurting me so bad. I have been at this hospital for over 2 hours and no one has been in to see me yet. Where is my nurse? Where is my doctor? Someone please help me.
Hi there, Mrs. Wheeler. How are you doing today? The nurses at the front told me that you came in because you're having some stomach pain. Is that correct?
Thank you for correcting yourself. My name is not Toots. However, I have been here for over 20 minutes and I have been waiting for someone to come in. My stomach is hurting me. That's worse. Oh my, I can't even talk.
Well, yes, I did just apologize. I'm going to have to do a few things. I'm going to have to take your vital signs and draw some blood from you, and then the doctor will be in, and we'll see what's going on with you here. Okay, Mrs. Wheeler? Well, now that I have all these things out of the way, I'm going to just touch your stomach just a little bit, and I'm going to just ask you, does it hurt? And you just tell me which section hurts, okay? Does this hurt right here? Ouch!
Yes, it does hurt right there. It hurts so bad. Oh.
Well, this could be very serious. I'm going to write this down and tell the doctor. Well, how long has this pain been going on?
It has been going on just this morning, but now it's gotten worse.
Oh, you say it's gotten worse, huh? Well, hold on. Let's see here. Let me just take all these notes down and... This is so annoying. I hate it when this thing goes off. Where is this darn phone?
I don't know, but I wish you would answer it.
Well, hello? Hello? Yes. Yes, I'm here with a patient right now. What? I had to come to the front right away. All right. You people are always bothering me when I'm trying to take care of a patient. I'll be right back, Mrs. Wheeler.
This is the worst darn hospital. My friends told me not to come here, but I came here anyway, thinking that I could get some help. Now I regret it. Well, hello there, Mrs. Wheeler. What seems to bring you in today? You mean they didn't tell you? I have been at this hospital for over 2 hours, and my stomach is hurting me so bad. I cannot believe this place. This is horrible. Now, hold on, Mrs. Wheeler. Let me get an idea of what this abdominal pain feels like. You said you've been having this pain since this morning. And what else is going on with you? Have you been having any nausea, vomiting, or diarrhea? In fact, I have been feeling a little nauseated for the past month, and I had some vomiting on yesterday, and I, I don't know. I don't know what could be wrong with me, doctor. Could you please help me? This pain is the worst pain that I've ever had in my life. Mm-hmm. So you say, Mrs. Wheeler. I'm going to have to ask Nurse Carson to come in here while I check you out.
Well, yes, did you ring, Doctor?
Oh no! It's quite all right, Mrs. Wheeler. I'm not very fond of her myself. But however, the shift is short and she is only one of two nurses that we have. Now, let's see here, Mrs. Wheeler. You just tell me if this hurts, and I'm just going to put a little pressure on your stomach here, and we're going to see what's going on with you.
Ouch! I can't take anymore.
Well, Mrs. Wheeler, I think I know what's going on with you. However, we would have to get some tests to confirm this diagnosis. I believe you have an inflamed appendix, and this could be easily resolved. However, you would have to have surgery. Oh no! I hadn't planned on having surgery. I don't know what I will do about my kids and my job.
I told you she would be a problem.
A problem? You are such a mean nurse. You have been so rude to me ever since I've been here. I'm leaving this place. I don't want to have surgery here. Now, Mrs. Wheeler, there's no need to get upset. Oops! Oh, my. Well, looks like you have a lot to clean up, Nurse Carson. I'm going to go ahead and tell the fellows prepare for surgery. And, in the meantime, Nurse Carson, let's get this patient cleaned up and prepare her for surgery. Well, looks like this just became more emergent. Let's call a code.
Just great. Look at all of this I have to clean up.
Now, how do you all feel about what you have just experienced?
This poor lady didn't get the help she needed in a timely manner.
Yes, this is quite true, Amanda. Although this is an extreme case and hopefully does not typically happen in our country's healthcare system, it shows a cascade of events that can easily be broken down and applied to critical incident analysis. Now, does anyone else want to express their feelings regarding this film? Yes, Miles.
Yes, Mrs. Ross, there was a definite breakdown in this facility's communication system. The nurse also appeared very uncaring and rude and lacked empathy for the patient that was in her care.
Yes, Miles, this is true. Now, this clip is not used to display nursing in a negative way. However, it was designed to do just what you are doing now, and that is to ignite your feelings. This clip or video displays how important critical incident analysis will be in your careers as nurses. Now, before we started the clip, I stated some very important benefits of critical incident analysis. Can you name those benefits, Susie? Yes, I can, Mrs. Ross. Critical incident analysis improves communication within the healthcare system. It improves training skills and assessment skills among clinicians. Very good, Susie. Does anyone else have anything to add? It also improves critical thinking and concept mapping, and most importantly, patient safety. Very good, Amanda. However, let's not forget the safety of the clinician, which is very important during an emergent situation or a crisis. Now that you all have down the benefits of critical incident analysis, who can define the use of its application in nursing?
I can, Mrs. Ross. Critical incident analysis is used to evaluate a powerful or an overwhelming event like a code blue.
Very good, Miles. Now that you can define how critical incident analysis can be used and applied to nursing and list its benefits, it is my wish that you can take this experience and apply its importance to your own practice. Thank you all for your attention, and I hope that you have enjoyed class today. Until next time we meet.